Welcome to Chapter 1 of Introduction to Public Health. In this video, we'll explore what public health is, how it differs from medicine, and why it matters more than ever in the 21st century. Think about it. From the water you drink to the laws that keep you safe on the road, public health plays a crucial, often unseen, role in keeping communities healthy and secure. Section 1. What is public health? Public health isn't just about doctors and hospitals, it's about creating the conditions that allow entire populations to thrive. As Charles Edward Winslow, a key figure in American public health, defined it in 1920, it's the science and the art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. This classic definition is still considered valid today. Later, the Institute of Medicine expanded on this, defining the mission of public health as the fulfillment of society's interest in assuring the conditions in which people can be healthy. It's big picture thinking, focused on communities, not just individuals. At the heart of public health are three essential core functions. Assessment. This is like the diagnostic phase, where public health agencies gather and analyze information on a population's health to identify problems. Policy development. Similar to a doctor creating a treatment plan, this involves using scientific knowledge to develop strategic approaches for improving community health. Assurance. This function ensures that necessary services for public health protection are available and accessible to everyone, whether provided directly or through regulation. Section 2. 10 Essential Services. To put these core functions into action, a committee translated them into a more concrete set of activities called the 10 Essential Public Health Services. These include vital activities like monitoring health status to identify community problems, diagnosing and investigating health hazards, and informing and educating people about health issues. They also involve mobilizing community partnerships, developing supportive policies, enforcing laws, linking people to needed health services, assuring a competent workforce, and evaluating the effectiveness of health services. And finally, continuous research for new insights and innovative solutions ties all functions together. Think of these services as the operational backbone of how public health agencies function, from national to local levels. Section 3. Public health versus medical care. So, how is public health different from medicine? It's a fundamental distinction. Medicine focuses on the individual, diagnosing and treating illness in a single patient. Public health, however, regards the community as its patient, focusing on preventing disease and improving the health of the entire population before illness even starts. And here's a striking fact. In the 20th century, life expectancy in the US increased by 30 years. But remarkably, only about 5 of those additional years can be attributed to advances in medical care. The vast majority, 25 years, came from public health improvements, such as cleaner water, better nutrition, improved housing, sanitation, and occupational safety. Public health is prevention. And this prevention often goes unrecognized, because success means nothing happens. As Winslow himself noted, it's hard to see the silent victories of public health. This invisibility often leads to less attention and funding compared to medical care, with less than 3% of the US total health spending devoted to public health. Section 4. The role of politics. But even when the science is clear, action requires political will. Public health decisions are often made by governments, at federal, state, or local levels, and are shaped by policies, budgets, and community values. Consider policies like requiring immunizations for school entry, banning smoking in public places, or mandating seatbelts. These are all political actions grounded in public health science. However, such measures can be controversial, especially when they may limit individual freedom. Politics is both a barrier and a bridge for public health. As public health professionals, understanding the political process is critical to creating meaningful change. Section 5. Sciences supporting public health. Public health is built on a robust foundation of multiple scientific disciplines. Epidemiology, often called the basic science of public health, is the study of epidemics, focusing on human populations to identify causes of disease outbreaks. It's crucial for tracking new diseases like AIDS, and for preventing the spread of established ones like food poisoning. Statistics help us interpret vast amounts of health-related data collected by governments, informing experts about a society's health status and weaknesses. It's essential for calculating risks and analyzing studies. Biomedical sciences provide the understanding of how diseases develop and how infectious agents spread, which was critical in controlling major killers of the 19th and early 20th centuries. This field continues to be vital for understanding new diseases like AIDS and non-infectious ones like cancer and heart disease. Environmental health science focuses on preventing disease spread through water, air, and food, relying on engineering for safe systems and epidemiology to track environmental causes. This area is constantly evolving with new environmental challenges. Social and behavioral sciences examine how human behavior and the social environment influence health. This includes understanding factors like nutrition, exercise, smoking, substance abuse, violence, and disparities in health based on socioeconomic status or ethnicity. Finally, health policy and management, or health administration, studies the medical care system itself, its effectiveness, efficiency, and equity, and the administration of public health systems. Together, these sciences help us understand and respond to the complex factors that affect health. Section 6. Levels of prevention. A key concept in public health is prevention, applied at 3 distinct levels. Primary prevention aims to stop an illness or injury from occurring at all, by preventing exposure to risk factors. Think of vaccination programs, efforts to discourage smoking, or banning lead in paint. Secondary prevention seeks to minimize the severity of an illness or the damage from an injury once the event has occurred. Cancer screenings designed for early detection are a prime example. For traffic safety, this includes designing safer cars with features like seat belts and airbags. Tertiary prevention aims to minimize disability by providing medical care and rehabilitation services. This could involve medical treatment and rehabilitation for cancer patients, or the development of emergency medical services after a car crash. Each level plays a crucial role in reducing death, disability, and healthcare costs. Section 7. The chain of causation. Another helpful model for designing interventions is the chain of causation. This model typically involves 3 parts: an agent, a host, and the environment. Originally used to explain infectious diseases, where the agent might be a virus and the host a susceptible human, this model also applies to injuries, chronic conditions, and even mental health. For example, let's consider youth suicide, which is sadly the second leading cause of death in the 15 to 24-year-old age group. Here, the host is the susceptible young person. The agent is most often a gun or an overdose of pills. And the environment includes the young person's entire social context, such as family, school, and social media. Public health interventions can target any point in that chain to break it and prevent harm. For instance, a public health intervention for youth suicide might focus on making young people less susceptible to self-destructive thinking, or critically, on limiting access to the agent, especially guns, as access is a strong predictor of success in suicide attempts. Section 8. Public health and terrorism. Public health also plays a critical role in emergencies and large-scale events. After 9/11 and the 2001 anthrax attacks, it became abundantly clear that a strong public health infrastructure is essential for responding to bioterrorism, natural disasters, and pandemics. While law enforcement primarily focuses on preventing violent acts, public health steps in for secondary and tertiary prevention, minimizing damage and providing medical care. Preparedness plans, emergency medical systems, and disease surveillance are all part of public health's invisible shield. The anthrax attacks, in a strange twist of irony, did more to educate the public about the importance of public health than any educational campaign could have. These events reminded the world of the importance of investing in strong public health systems, not just during crises, but every day. Closing. So, as we've seen, public health is the science and the art of prevention. It's political, it's scientific, and it's absolutely essential. While its victories often go unnoticed, they're all around us. Longer lifespans, fewer infections, cleaner environments, and healthier communities. In the chapters ahead, we'll delve deeper into the tools, controversies, and strategies that define public health in action. Thanks for watching, and don't forget to subscribe to continue your journey through public health.